Welcome back to 12 to Your Health. I'm Dr. Derek De Silva. This time of the year is the worst for colds and flu, even more so this year due to the swine flu. Cold and flu season can be especially hard on children due to their weaker immune systems, and one of the most dangerous complications can be dehydration. It can sometimes take multiple sticks with a needle to successfully place an IV, which can obviously be a very unpleasant experience for both child and parent. There is, however, a new technology that avoids all of these needles. Here to talk about it is Dr. Michael Bissett. He's the emergency room director of Jersey City Medical Center. And Dr. Bissett, welcome to the program and thank you for joining us.
Thank you for having me.
So why are children and why do people get flus at this time of the year and right now, more importantly, swine flu?
Well, there's two major issues. One is that people are grouped closer together because of the weather. People tend to stay inside and be in closer contact with each other. Also, the temperature itself has an effect on the activity of the virus. Viruses that cause these typical respiratory and stomach ailments are more active during colder temperatures.
All right, so it's the closed environment. People need to open up their windows a little bit more on nicer days. I mean, I tell people that all the time. Really important to do. But what about dehydration? What produces dehydration?
Dehydration is caused by two main problems in children. One is the fever itself. When you're having a fever, you sweat more, you breathe more with your mouth open, you lose more fluids in that way. The second problem is when you have stomach ailments and children are vomiting and having diarrhea, they can lose tremendous amount of fluids and become dehydrated very quickly.
I mean, this is the same for adults also, correct? But it takes a little bit longer?
Absolutely. Adults have more of a reserve for their fluid management, so it takes longer for them to become dehydrated. Small children, especially young infants, can become dehydrated within a matter of hours.
I see. And how common is dehydration in children?
Dehydration is one of the most common things that we see in our emergency departments at this time of year. And it is, like you said, the biggest complication of these viral illnesses.
And what do people need to look for? What are some of the symptoms of dehydration?
Well, primarily we're looking to see
and we have them on the screen right now, so
that the child is not having extreme weight loss, that when they cry, that they're having tears, they have a little bit of drool in their mouth for small babies, that they're still making urine, which can be monitored by their diaper changes,
right?
That they are not appearing sleepy or listless, they don't have dry mouth, and that their eyes still have a normal glow and sparkle to them, that they're not getting sunken or appearing that they're pasty or dry.
And what, I mean, okay, so somebody's dehydrated. What is the biggest issue? Why is this so serious?
Well, dehydration is the #1 cause of death in these sorts of viral illnesses. When one becomes dehydrated, the blood pressure starts to drop, your electrolytes become altered, which means that your nervous impulses that control your heart and your brain and your other muscle activity is not going to work the way it normally should.
And I guess one of the biggest issues is, at what point do you take the children, or a child or adult, to the emergency room? How do you make that decision?
When your child is showing signs that they're not behaving normally because they're listless or tired, or that they're not having that urine in their diaper for 3 hours like we showed on the screen there, those are major problems and they need to be evaluated by a physician immediately.
Now, is there an effect with respiratory rate, meaning how fast they're breathing, their heart rate? Do those things change at all with dehydration?
You will see an increase in respiratory rate. You will see that their heart rate will increase, even though they appear drowsy and sleepy. When you put your hand on their chest, you'll feel that it's moving more frequently and you're getting more beats.
And that's, again, another issue. And so the parent takes the child to the emergency room. What do they need to tell the emergency room doctor, and what do they need to look forward to or expect while they're in the emergency room?
Well, obviously what they should expect is to get a rapid evaluation for their child. The sort of questions that we're going to ask is, how long has this been going on? How much is the child trying to take in? How many times have they vomited? How many episodes of diarrhea have they had? When did the fever start? What sort of medications have the parents used to control the fever or the vomiting or the diarrhea at home?
Now, let me ask you about that, because this is something that we haven't talked about, and I haven't talked about in this show in a long time. children that have colds and flus, and you think it's flu, it is a flu, it's a virus. There were many years ago we were told not to give children aspirin because of something called Reye's syndrome. What do you, as an emergency room physician, tell moms and dads to give their children if they have a fever and things like that besides aspirin?
I like to use a combination of Tylenol and Motrin. It's by switching between the two of them in alternating doses, you reduce the toxicity that you might get from either one of them.
Right. So the bottom line is no aspirin, Tylenol, and Motrin.
Correct.
All right. How did we traditionally replace fluids, and what is the new technology that you're here to talk about?
The traditional method has always been intravenous therapy, which means putting a small plastic catheter into a vein when you can find one and trying to give fluids, saline or dextrose solutions through that IV to rehydrate the child.
Right.
The new technology that we have today allows us to...
And here's the technology that we're talking about right here.
So what you can see here on the screen is that we no longer have to find a vein. We can put the line into an area that has much fewer nerve endings. In this case, the child has it in the middle of his back. He will feel a slight stick at that time, but then afterwards will really not even recognize that the line is there. This medication, Hylenex, that they're showing there on the screen, allows us to break down that space in between the skin and the muscles to form a cavity where we can place the fluids and they can be absorbed by the body very easily.
I see. So they don't. So you don't need to do the needle stink, and this is something that is a lot easier. I mean, that seems to be the whole gist here, right?
It's much easier. It takes one shot. We get the medication in. We then get the fluids in. The child is rehydrated. On average, they go home 2 or 3 hours sooner than they would have otherwise.
Wow. Amazing.
And everybody ends up much happier.
Yeah, absolutely, especially
the doctors included.
The doctors included. What about prevention? You know, a child is vomiting, they have diarrhea. What's the best way to I guess the best thing to do is rehydrate them, but how? At home?
Rehydration is very important. When children are vomiting or having diarrhea, we want to get something into them that's not going to worsen the problem. Now, liquids that are very sugary can tend to cause more diarrhea and cause more upset stomach. So we want to try and stick with something that's not quite as sugary, but we don't want to go all the way to the extreme of just pure water, right? Because that can cause some problems with their electrolytes. So the
Pedialyte,
like
I mean, is what we want to use? Some of the Pedialyte solutions?
Pedialyte is a very good solution.
Okay.
Also, some of the other sports drinks can be used in older children, but they should be avoided in smaller children because they can cause this worsening diarrhea that we spoke about.
Hey, thank you so much for this great information. Great to have you here.